You're inside a live, and it's another time on a Monday where, we discuss things related to the body talk, yeah? That's all the things. We're going to talk the things inside alive today. Yeah, man, as we enter into this new year, many of us are making resolutions to prioritize our health and well being. This year, Dr. Dainia Baugh, chair of the HIC Foundation, internist and menopause specialist, wants to encourage women to put their heart health first. Dr. Baugh is a passionate advocate for women's health and a leading expert in her field. Yes, with her unique perspective and expertise in areas of functional, integrative, and aesthetic medicine, Dr. Baugh is eager to empower Jamaican women to focus on the heart of self-care. Dr. Baugh will discuss how caring for heart health is directly related to other areas of women's health: mental, emotional, physical, and hormonal. She will highlight common misconceptions about women's heart health, simple lifestyle changes women can incorporate into their daily routines to improve heart health, and the importance of early detection and prevention. She hopes to encourage listeners, and me to learn some things too, so I can encourage my fellow women, well, the women that I know,
Yes.
to make heart health a top priority in 2025 and to empower them to take control of their well-being. Hello, Dr. Baugh.
Hello, hello, hello.
Welcome. Thank you for joining us here inside inside Body Talk.
You're so welcome, and I'm happy to be here.
Awesome. I know we have so much to talk about, so we're going to jump right into it. Now, Dr. Baugh, as an advocate for women's health, what inspired your passion for focusing on the heart of self-care, and also how does it align with your work at Heart Institute of Jamaica?
Okay. So, the truth is that women's health is always undervalued. It's
Mhm.
always overlooked, even in the medical community, right?
Mhm.
So, when you think about studies that are particularly focused on women's health issues, there are very few.
Mhm.
Um, when we had a study that was large, that focused largely on menopause and hormones and its impact on women's health and cardiovascular disease, it was stopped early and the findings
Mhm.
were incorrect.
Mhm.
When you're looking at other issues, pretty much what we've had to do forever is to take all the studies that relate to men and
Mhm.
just extrapolate from them that, oh, well, we're little men, so it must apply.
Wow.
So the truth is that not everything applies, and sometimes our physiology is different.
Mhm.
So, I am as much a passionate advocate for justice as I am for healthcare. And so I'm just like, no, man, you
Mhm.
know, we have to. So I've just always been really interested in not just the health of women, but how to make sure that our needs
Yes.
are addressed in a way that makes sense for us to have vibrant health.
Wow. I didn't know all of this. Thank you so much for
Yes.
sharing that. And it's a beautiful segue into the next question I want to ask you. What are some of the most common misconceptions about women's health that you encounter? And also, why is it so important to address these misconceptions?
All right. Perfect. So, one of the most prominent conceptions I hinted at in the first question is
Mhm.
that everything that applies to men, if we just adjust for body weight, then surely it must apply to women and we treat
Wow.
accordingly. And
Mm.
I don't think that that's always correct. And I think we need more attention paid to how we change, how we differ, how our hormones make a big difference, for
Mhm.
example, to our physiology. So, high blood pressure, yes. Why is it happening to us later than men? Why
Mhm.
does when we approach menopause, for example, increase our risk of high blood pressure and heart disease? How
Mm.
does pregnancy impact? So it's like so many things that we've just assumed that
Yes.
we have the same reasons and the same outcome. And I
Mhm.
think that that's a big myth.
Mhm.
Another big myth that I think applies specifically to women's health is, for example, during pregnancy. A lot of women have what we call eclampsia and preeclampsia, where their blood pressure goes up during pregnancy, right? And
Mhm.
then after they've had their follow up, usually 6 weeks or so, if the blood pressure is down,
Mhm.
we tell women, or women assume that, okay, all is well. I don't think that women realize that that
Mhm.
gives them increased risk for follow on high blood pressure down the road.
Oh, okay.
Yes. And that risk of high blood pressure and heart disease lasts for the next 46 years.
Ah, wow.
Yes. Here's another big misunderstanding and myth. So I have high blood pressure.
Mhm.
And one of the things that came out, we had a huge conference this week with experts from Yale and experts from the Heart Institute of the Caribbean
Mhm.
exchanging ideas.
Mhm.
And even I was blown away to
Mhm.
understand that cutting edge data is showing that if I have high blood pressure and I have a child, that
Mhm.
that actually gives risk to that child of early high blood pressure, even in
Yes.
their adolescent
Wow.
years. So there's so many things to learn, and I'm so excited about
Wow. Yes. I'm just listening like I'm in a classroom. I'm sitting and I'm like, taking my notes.
I know.
You touched on something about high blood pressure uh in adolescence.
Yes.
And let me ask about that now because it's quite overlooked in younger women. Like you say, you don't have it. It's okay. You'll grow it out.
Yes, yes, yes.
What advice would you give Jamaican women in their 20s and 30s about maintaining cardiovascular wellness?
All right. Good question, because this is a thing too that I've been drumming. I
Mm-hmm.
think Jamaicans in general, women in particular, and
Mm-hmm.
young people even more specifically, think that they don't have to get checked unless they feel something.
Jeez, yeah.
So unless my head hurting me or
Mm-hmm.
my throat sore or my back, unless there is pain and or discomfort, we're
Mm-hmm.
not forced to go get checked, right?
Mm-hmm.
So what I want to stress to women is that heart disease is happening earlier and earlier. And
Mm-hmm.
therefore, to know your numbers now is important. So, for young people, if you don't know what your blood pressure is, how do you know what your risk is? How do
Right,
you know if you need to do anything
right.
about it? Right?
Mm-hmm.
So, people say, oh, but why would I need to check? I don't have high blood pressure. And
Mm-hmm.
my answer is, how do you know? Right? if
So difficult.
if you don't turn on the light, you don't know if power gone, right?
Yes, yes, yes.
So what I always encourage, we need to check our blood pressure at least once a year if all is well.
Mm-hmm.
We need
Mm-hmm.
to get our cholesterol checked at least every 4 years, and
Yes.
that's if all is well. We
Mm-hmm.
need to get our blood sugar checked at least every 3 years, and that's if all is well. If
Yes.
anything changes, then that recommendation changes. So let's
Yes.
say you have a strong family history of cholesterol problems, then why would you wait 4 years to check again? You see what
Mm-hmm.
I'm saying? So the
Mm-hmm.
most important thing I can say is don't wait till something hurts you. Get a doctor, hone in on that doctor, that is my primary care doctor,
Yes,
and
yes.
see that doctor at least once a year,
Mm-hmm.
whether or not there's anything wrong with you. And
Wow.
then to my doctors, I say, get in the habit of establishing a continuity of care clinic So you have patients that you recognize as your patients and
Yes.
not just patients that are coming in for urgent care visits.
Right, right, right.
So
Wow.
young women get checked.
Wow. I love how you are hinting at the different things that I really want to ask, and I'm sure the
Okay.
listeners want to hear as well. Let's move on a little bit, and I want to talk about, because you hinted at some things about how important it is to take care of yourself from early and figure out what's happening with you from early, so you know by the time, if you figure out if anything should happen, you know what
Right.
to do quickly. But what are some simple yet impactful lifestyle changes you made mention of one so far women can incorporate in their daily routine to
In there.
improve their heart health?
Can I tell you?
Hmm.
Sleep. That's going to be my number one recommendation.
That is for everybody, men and women. Darren needs.
Man, woman, boy, and girl, sleep. Effective and efficient sleep is key. It's not just about how long we sleep, and we are knowing now that certain groups of people need more sleep.
Hmm.
Young people need at least 9 hours to 10 hours of sleep, and we're not getting that.
Who you define as young people? Quickly.
Teenagers,
Yes.
right?
Yes.
Menopausal women need about 9 hours of good sleep.
Mm.
Women in general, we need to try to be getting our 8 hours of restful sleep.
Hmm.
Exercise. And I don't mean you have to lift up big tile. You can't movement every day,
Hmm.
deliberate movement, right? Sunshine. 10 minutes of sunshine helps our vitamin D. Eating more fruit and
Yes.
vegetables, less sugar. We now know that no amount of alcohol really is safe
Mm.
and or healthy for us. So minimizing alcohol and pretty much just being happy. Live a
Wow.
good life, good to people and make people good back to you. And
My,
that's the answer.
see there? Simple. Simple. Let me, well, I want to wrap this up, but let me just take this advertisement real quick and come back to you. All right, doctor?
Certainly.
Boy, oh boy, if you're not listening, if Mentalist, if you're not here, you won't know. We have so much to share inside Body Talk today. Let me take care of some business real quick, and then be back with so much more.
Need to brighten up your dimly lit spaces while saving on electricity? Look no further! Switch is having a 30% off solar lighting sale, January 2 to 31. Solar garden lamps, wall mounts, and solar flood lamps. Visit us in Kingston, Mandeville, Drexel, and Montego Bay. Don't miss this solar lighting sale, January 2 to 31. Open Sundays, 8 a.m. to 3 p.m.
You're tuned to Love 101 FM, the family station. You're inside Live. And yeah. It's time for Body Talk. We're wrapping things up inside Body Talk with Dr. Dainia Baugh, chair of the HIC Foundation. That's the Heart Institute of Jamaica Foundation. My friends, so much was shared. And we're wrapping things up real quick. But may I tell you, we could talk with her all day about, the importance. Oh my goodness. The importance of making the heart of self care for women, especially. Doctor, just to wrap things up now, can you just tell us how do mental, emotional, and hormonal health intersect with heart health, and what steps can women just take to ensure a balanced approach to overall well-being?
Okay. Remember, I left off the last segment with
Mm.
happiness. Happiness and emotional balance is key to everything.
Yes.
Let me drill down on hormones for a quick minute, right?
Mm-hmm.
Hormones control every single part of our being, from the tip of our toes to our feet.
Mm-hmm.
So if your hormones are off balance, out of kilter, then everything else follows suit. So when we're going through those changes, seek help. Come in, talk to us, right? You can always get us at the Heart Institute of the Caribbean, 23 Balmoral, 906-210-5 through 8. And of course, it's area code 876. But
Yeah.
it's so important for you to know that it's not just business as usual when you're going through hormonal changes and those transitional phases.
Yes, my goodness. Doc, I listeners right now say we need to have part two. And we need to
All
talk
right.
some more about this because and especially the menopause. Someone said about menopause as well to talk a little bit more about menopause. Someone left a voice note. I went play it real quick and Doc,
Yes.
I'm gonna play it for you.
Okay.
Yes, doctor, trying to see if I can wrap this up as quick as possible. Sister Ray here. I get two heart attack. I was more paying attention to the kidney problem because of the death of my mother and my sister. So I was paying more attention to the kidney. However, I got a heart attack.
Mm.
When I got it, I need stent. I have to do, the money for this was stent thing. You would know that.
Yes.
With that, and last year, I get so upset that my heart rate would not go down. Rush to the hospital. I've never fallen down, never knock out. I am knowing what was happening to me. The doctor said they couldn't get the heart rate down. They had was to give me a sign in to give me a medication to knock it right out, pump me back in to life. Can you imagine? I did that.
Yes.
It did not me out neither.
Mm-hmm.
So, I mean, I take my blood pressure and the pulse would always read up or down. Is that accurate when the pulse give us that reading so we can follow up so the heart is racing? Why not?
And the short answer to that is yes. If you check your pulse, either by counting, just so you put your fingers on your pulse and count it using a clock, how many beats per minute? Yes, it's accurate. If you have a Apple Watch or something, for example, and it counts it, it's accurate. If you have a pulse checker, it's accurate.
Yes.
So if it goes outside of that range that we want, if it goes over 100 for the top, if it goes under, let's say 50 for the bottom, please, yes, we need to get you seen. All right. For most women, I would say 60 should be a bottom, just because I know most Jamaican women are not well-conditioned athletes.
Right.
So if you're a big-time athlete, your pulse can run a little lower. But for most of us, 60 to 100, anything outside of that, come and get checked.
You heard it from Dr. Dainia Baugh. Listen, my friends, indeed, we have to have part two. So I'll talk to my producer and say we can make this happen because this information I needed and so necessary. So many questions coming in. I know we can't answer all of them right now, but we'll talk, Doc. We'll
This
talk.
needs crowd, is what you're saying. This needs crowd.
Thank you for joining us. I know you have a busy schedule. And you took the time out to join us today inside Body Talk. Really appreciate you. Have a wonderful rest of the day, Doc.
Thank you so much.
You're welcome. That was Dr. Dainia Baugh, chair of the Heart Institute of Jamaica Foundation. And listen, my friends, pay attention to your health. Yeah, and some people would say your health is your wealth. Yeah, man, and we need it in order to do good things in the kingdom, in the workplace, and all these things. All right, yeah, man.